Hello, how's everybody? Welcome to the iCON forum today. I would like everybody to pay attention to the following housekeeping announcements. If this is the first time that you are participating, please pay attention to these announcements. So in addition to being able to hear in Cantonese, you can also choose either Mandarin or English audio. So you can click the Zoom link, the language part, and make your choice of whether you want to hear it in Mandarin or English. And you will see another screen where you can see the interpreters. When you listen to the interpreters, please mute that Cantonese part so that you will not be confused. And we've also arranged many community organizations which hold booth exhibitions here. So on the on-air platform, you can go back there and choose health exhibition and click on it, and you can see the booths that we have arranged for you. And you can see that each organization has a lot of information offering for stroke. Today in our session, we will have a lot of questions and answers, as well as surveys, polling questions. And we hope that you will help us by answering those questions, which will help us to collect the opinion from the public, and it will help us improve our future events. We'll follow up by phone in 1 or 2 months. So I would like to test our polling, because some of them may be joining us for the first time today. So can we have the test polling questions, please? Right. So this question says, what is your biggest health concern as you get older? We have 5 choices for you. Choose the one that's most appropriate for your situation. It's A is chronic disease, B is mobility issues, 3 is cognitive mental health, D is unable to care for myself, and E is not having someone to care for me. All right, okay, thank you. Now, today we have a Q&A session in which this will take part after all the speakers have spoken today. And if you have any questions, you can see the live Q&A box and write down your questions there. And we will try to answer all of your questions. In today's Q&A, we will also invite the 2 Dr. Ho's from yesterday. And that's Dr. Thomas Ho, and the other is another Dr. Ho, who have answered a lot of questions already. We're happy to have them again today. And as well, we have also invited Mr. Link, who is a pharmacist, to answer questions regarding pharmaceutical products or drugs. So you can write your questions in either English or Chinese. And I am Barbara Ho. I am the Chief Nursing Officer of the Chinese Department of iCON. Welcome everyone online. We welcome you all to today's iCON. This is the first time we're doing this online. It is take charge of your health, stroke management, and prevention. And if you are not familiar with iCON, well, I'm going to tell you that iCON is one of the projects initiated by the Digital Emergency Medicine of the Faculty of Medicine at the UBC. The main purpose is to help people in multicultural communities understand how to prevent and self-manage chronic diseases by organizing health seminars, workshops, and using internet technology. We strive to share the most accurate and reliable health information with you. Not only do we hope that the local people will actively participate in seminars and other activities, we also hope that the sharing of this health information can be extended to more remote areas and overseas through live webcasts and help everyone work together to improve their health. First of all, we have the Director of the Department of Digital Emergency Medicine of UBC School of Medicine and the Executive Director and Founder of iCON. He is also the moderator of this forum. Dr. Kendall Ho is here to give a warm welcome to you all. How are you, Barbara? Thank you. Everybody, I am Kendall Ho. As Dr. Ho, as Barbara said, I am the Director of iCON. I'm also an emergency doctor. So these are very familiar subjects that I often deal with, because people who suffer from stroke will have to see doctors. And when they come to emergency, we try to help them as quickly as possible. There are many issues about prevention, but I hope that you can take those measures without having to see me. So yesterday, in the first session, there were lots of participants, and I welcome those. And again, for those who participate today, and I know that we have actually more than 50 new participants today. So welcome our new participants. And like I said yesterday, our iCON forum has been going on for 14 years, since 2007. And a lot of our participants, we thank you for the support, and so that they are familiar with these medical issues. And also over the last 10 years, we have the Ministry of Health from the BC province come to support us. Like yesterday, we have Lindsay. And today, there's also another representative from Ministry of Health, BC, and from UBC, I welcome you all. And yesterday, we had the first session. We talked about how to prevent strokes, because there are many factors that you can change. And the second thing is, we talked about yesterday foods, how to make foods an instrument such as the Mediterranean diet pyramid to help you prevent strokes, and also exercises and relaxing to prevent strokes. And the third thing that we talked about was symptoms. Once you have those symptoms, what to do right away to reduce the risk and help the treatment easier, make it easier. And the fourth thing was, if there was any aftermaths of strokes, what are the best ways to recover for rehabilitation? So those were the topics that we covered yesterday. And if you didn't have a chance to attend the webinar yesterday, no problem. Sometime later this week, we'll post them on the internet. And in the second session, that is today's session, we have many authoritative medical experts to come and talk to us. And I will pass the mic back to Barbara, who will introduce to you today's speakers. Before I pass the mic back to Barbara, first of all, I want to thank many sponsors and our community groups for the cooperation. And I also appeal to you that we are in an exciting times, that our province and our country are starting to vaccinate people in the community. And vaccination not only helps yourselves, it also helps the society. So I appeal that you take your vaccinations as soon as possible. So without further ado, I will take you back to Barbara. Thank you, Kendall. Today, this is our second session. We're going to continue talking about the recovery process because after a stroke, those who have had strokes and the family who take care of those people, they need to know what to do and how to help them recover and rehabilitate. And also those who have strokes, their mental stress, a lot of mental stress. We will talk about mental health and also diet. We Chinese we place a lot of importance in our diets and foods. So we're going to talk about dietary management as well as resources in the community. Those are the themes, the topics for today. Yesterday, I have also mentioned that because of the pandemic, we're all staying home and we're not seeing the doctors that much, at least not virtually. And so we're trying to avoid getting the infection. So maybe there are symptoms that have come up, and so we've talked about how to deal with them, what are the risk factors, how to prevent strokes, those things. And today we have another group of speakers who will talk to us. And first of all, I will introduce them to you. The first one is Wendy Lam, who is an occupational therapist. He's a senior occupational therapist in this area in stroke management, very experienced. The second one is Dr. Tigerson Young, who is a clinical psychologist. And if you have participated in our fora before, you must be very familiar with Dr. Young because he is a very senior and experienced psychologist. Our third speaker is Winnie Lau, who is a registered psychiatric nurse. And we're very honored to have Winnie with us today. She works with Vancouver Coastal Health. She's been doing that for many years. And very soon you'll hear her talk about what she does in her work, and how she helps the community. And the last, of course, but not least, is Jojo Wang again. And she's coming back to talk about after post-stroke, that is, dietary management. She's, of course, a registered dietitian. So without further ado, we will have Kendall, our moderator, to say a few words. Thank you, Barbara. Wow. Today we have 4 authority, that is people who have a lot of knowledge in medical fields. First is we have Wendy Lam. So many participants have heard that Wendy, when she talked about as an occupational therapist, what her specialties are. And every time I listen to her, I learn a lot of new things. So welcome again.
So thank you everyone. Thank you, Wendy. There is one question. So I've been pondering upon it. So in order to understand the danger of stroke, even though we did prevention, and unfortunately, we still might have stroke. So today, let us try to understand what is the recovery process at home or in the community. So maybe I'll pass it over to you. So yesterday, there were a lot of experienced doctors to explain the experience after stroke and how to go to the hospital immediately. And the recovery after stroke can be a short time or can be quite extended. For several people, it can take a few months, but for other people, it may recover after a few years. So when we talk about hospitalization, our patients may be discharged and go home when the stroke is minor. However, if this is a little bit more serious, so there may be a longer period of stay in the hospital could have been 8 weeks, and then during that time, there will be the whole rehab team, the doctor, the physiotherapist, the occupational therapist, and also social workers to help. And during the time of hospitalization, there will be a lot of training and exercise. For example, toileting, changing of clothes. These are things or tasks that have to be handled every day. So strokes can affect different areas of our body. Maybe one half of the body we cannot manage, and there may be muscle weakness. The balance can be affected, or even the cognitively or thinking or memory can be affected. So the most important persons in the team is to train what you need training for. And during the stay in the hospital, there will be exercises to improve the strength as well as balance, and also to check what kind of apparatus would be required in order to go home safely. And during the time when you are charged, there will be another rehab team, which is in the community. So a patient can be referred to an occupational therapist in the community to check on the home environment, to work on trip or fall prevention, to check on what kind of apparatus you may need. Next slide, please. And that rehab team, for every stage, is very important for the family and the patients to communicate with the team. The family can help the team to better understand the situation in the home, and even further help the team to know what sort of activities are usually held at home. And keeping an active communication is very important. And sometimes there may be a family conference so that everybody can be on the same page and know what problems have to be solved. So safety is the priority when a patient returns home. And also, it is very important to understand how the rehab journey can be continued when the patient goes home. And of course, one thing is to practice what is required. For example, if a patient requires mobility, like walking or doing the stairs, then the physiotherapist may prescribe some specific exercises. And if for the arm and the hand, buttoning a shirt or holding objects are difficult, then the OT would concentrate on exercises like these. And so actually, I have already talked about a little bit about the physical changes, but actually stroke can affect many different areas of our body. For instance, balance and our posture. So sometimes we may not be able to sit at the bed. You may require some assistance. And for some people, mobility, you may need the assistance of another person or a mobility aid or walker. It depends on the OT and the PT upon their assessment what kind of apparatus would be required. And also it may affect somebody's bowel or bladder function. And also it may cause weakness in somebody's arms or legs. And also the vision or cognition can be affected. So what can be done? And what exercises can be done to improve the balance? Of course, you have to say what the OT and the PT prescribes. I'm going to give some examples later on. And also what the OT and the PT may prescribe for you. It may be a walking aid, like a cane or walker. And for those whose vision is affected, For example, you may see double vision, or you only see one side, and then so the therapist would suggest that you go to a specialist who is specialized in checking patients after stroke, and they may prescribe special glasses to improve that. And other than that, if going to the toilet, you may need some more support, or there is more inconvenience when going to the toilet, and therefore there would be more understanding for the OT to understand what situation you may have for your toileting, and then exercises can be prescribed to help train the ability. And there may be a routine for you for going to the toilet. And also there will be exercises prescribed to strengthen the limbs. So at home, what can be changed? What adaptations or modifications can be done? Family can be of a great help, because you can measure the height of your tub or the bath or the toilet bowl, and you provide such information to the rehab team, and this would smooth out the transition of going home. And everybody has, a powerful cell phone now, so you can take a picture of the environment at home and send it to the team, and that would be a great help. Another thing that can be helpful, so maybe to understand the situation in your toilets, so to decide whether bath benches or grab bars would be required. Usually the occupational therapist would pay a home visit to further understand. And the occupational therapist would also give you a prescription so that you can go to Red Cross and you can borrow things like the toilet seat or walker from them. And also, if you're a handy person, so you can install such grab bars at home, and OT can mark the suitable spots for installation to help the patient, and the handy family members can do all these on your own. So we have already mentioned that the community OT can provide equipments, and also they can try to understand whether home care services like helping with baths are required when the patient is discharged. So if that is possible, that is required, a home care person can come into the home to help with bathing. So depending on what the patient requires, the community can help provide such services. And actually, during the COVID-19, so what help can be offered? Because currently, everybody is trying to avoid coming into contact in the hospital and being exposed to other people, and then we try to keep social distance. And what rehab services can be provided in the community? So actually, when a patient is discharged, say after 1 week or two, and then after everything is settled, the hospital, there would be an outpatient department. The patient might be referred to the outpatient services to see their OT and PT. However, because of COVID-19, so such visits are further reduced. So that can be done through the telephone, or sometimes we use an iPad or use the computer. So we try to do the virtual health, and virtual care can be provided. So I think you can use Zoom You can use a computer, webcam, so all these devices to help. And the good thing is to continue with your exercises even when you're at home. The benefit, of course, with you don't have to drive, you don't have to look for parking and pay for parking, and you don't have to expose yourself to, a new environment. So besides being referred to the outpatient department, and if you have to wait a longer period before you can see a therapist, there are always a private therapist that you can go to. However, you have to pay from your own pocket. But if you have to wait a long time before you can see a therapist, so you can plan on that so that you can continue with your rehabilitation. So, a lot of information, Wendy. I really learned a lot from you. There are two short questions. So after stroke, how can we get hold of you? So in the hospital or after we are discharged? So, or you would come. Services, how can it be reached? So actually, when a patient is at home, in the hospital, there would be an occupational therapist in the hospital. And then when you are discharged, there will be another team in the community. They also have the occupational therapist and physiotherapist. There will be a few specialists to take care of you. And for outpatients, actually, it is for patients who are discharged, but you can go back to the hospital without having to stay there. You can stay at home. However, you can go to the outpatient area, doing 1 to 2 hours of therapy with the physiotherapist or the occupational therapist, and then you can go home. And that will be outpatient. For the private ones, then you can connect BC website. You can find private practice therapists, and many of them run private clinics, and you can go to them. Oh, I understand. So already in the hospital, there will be an occupational therapist. And then if you have questions, better ask the OT before you are discharged. Oh, good. So there was once I heard you gave an excellent speech. So which areas at home that are of higher risk? So which areas at home we have to pay specific attention? I think the toilet, the bathroom. Because when somebody takes a bath or shower, and then when it's slippery and wet, so it's easy to have a fall. So therefore, it is very important to see whether there will be adaptations in the toilet. And you can, of course, you can do any kind of grab bars on your own, but you have to go drill into the wall. Oh, thank you, Wendy. So Wendy has a lot of information. And if you have any further questions, you can go to the icon on the right, and there will be the Q&A section. You can type in your question, and then we are going to try to go to that in the Q&A section, and Wendy will be there. So Wendy, thank you. So there is a little bit of on the exercises. Oh yes, let's go to that. So actually, even in the community, there are different virtual programs. So if you go to Stroke Recover BC, they already provide virtual programs. For example, exercises on the wheelchair or on the chair. So go to the website and you can get information. And also a lot of information arm exercises. So the next one, I took this information from that website. And on Fraser Health's website, there is also information on how to train your legs to improve balance. And they call it SAIL, S-A-I-L. And these are more simple exercises to train your thigh muscles So you can hold on, say, to the counter or some place that is secured so that you can train your legs. And this is very good information. And physiotherapy can also check to see which exercises are suitable for you. And the next slide would be for your upper extremity. So UPC has done a study to check which exercises are the best to help the upper limbs. So this one, they call it GRASP. So it means these exercises are targeting at arm exercises. It can be finger grips, so you may be picking up small objects, or you can be practicing buttoning your shirt. So you can find all these exercises on GRASP, and you can go to the website. And in the hospital, actually, these tasks already would be prescribed. And the main thing is when you go home, you have to continue. The good thing and important thing is these exercises are graded. So you have to understand what is good for you. But what is important is do them repetitively. So the suggestion is, so do these prescribed exercises 1 hour every day. So not all in 1 hour. You can spread the hour, say a little bit in the morning, 20 minutes in the afternoon, and 20 minutes before bed. So continue with this for at least 8 weeks. The next slide. And also there would be exercises to improve cognition. For example, like the iPad or the tablet, there are exercises to improve your memory, and you can refer to that. So what can be done to improve our memory? One thing is enough sleep and rest. And try not to do too many things in one day because you may be overwhelmed. And eating healthy and stay hydrated, things like these. And these are most important. So relax your mind so that you can manage things that you want to do during the day. So simplify your daily routine. And the next one, we talked about online games and so on. So on the next page, there will be a lot of information. And there are apps who can help relaxation, mindfulness, so that you can be more relaxed and be ready to do recovery. Oh, bravo, Wendy. Oh, I miss out on that. Oh, so I almost missed out. Have I missed out anything else? Oh, that's about it. Okay, so thank you, Wendy. So everybody has heard about Wendy's experience sharing. So if you have questions, please type it into the box. So thank you, Wendy. And the next section, we have Tigerson Young. So Dr. Young, before he comes, of course, we look forward to hearing his presentation. But before that, let us do one poll question. And yesterday, if you had joined us, you know, usually it would be about what has been shared by the occupational therapist. So do you find it helpful? Do you find it helpful? If you find it very helpful, then say strongly agree, or you can choose other choices. Now the poll is open. And please put in your input. Okay, so well, everybody is actively responding. And then when you are answering the question, actually, you can try to think, would there be anything that you would like to clarify? Then you can also put in the question in the Q&A box, and hopefully we can have Wendy to address your question. Okay, great. So now 60% would say strongly agree. And then, yes, so there would be other responses. But thank you for your responses. And if there are anything you cannot decide, put it into the box for the Q&A. So let us go on to the next part, Dr. Tigerson Young. So Dr. Young is very familiar because he has come to our iCON forums for many, many times, and he delivers excellent speeches, and he is a star in the media. And everybody, and most of you have listened to him. Tigerson, welcome. So thank you for helping.
How are you, Dr. Ho? How are you doing? First of all, I want to thank you, and I'm very happy that iCON is holding this very large-scale forum again and giving me another opportunity to share with you a little bit of my input. Thank you, thank you. Thank you, Dr. Young. Now, let's cut the cheese and cut to the cheese. Now, for a stroke, if someone has a stroke, we talked about physical recovery. How about mentally? What are the impacts that a stroke causes on the mental side? Well, it's a very important topic. We'll try to look at it from different perspectives, all right? Let's look at the next slide first. So how often or how common is stroke, especially among Chinese communities? Okay, I think many of you have already pointed out that strokes are one of the biggest 10 killers. And lots of research have proved that maybe 3 out of 10 people have suffered strokes, or whether they eventually die or disabled as a result. So it's not that much, but it's not too little. So especially among Chinese people, Chinese communities, a lot of Asian people of Asian race is kind of on the low side, but the other ethnic communities is probably higher. And some research, especially those in Canada, have proved about the same thing, that is among Chinese communities, the proportion is probably a bit lower. There's one that was done in Toronto, and there's only 0.6%, which is, I think, good news for us. And what's interesting is that in China, there's some research done in China, and they found out that in China, in some regions, they are even higher than those in North America. So, and different provinces record different ratios. So roughly, this research, if it's accurate, about 3%, okay, that's 3 out of 100 people have strokes. So in China, it's about 5%. And there are also regional differences. There's also Xinjiang, and from 5% to 7% in Heilongjiang. So it's a huge discrepancy. So this is interesting. So the way I look at it is, the good news is, well, usually on the average, the risk that Chinese communities face may be lower. The bad news is that maybe there are some new immigrants from China who have just come to Canada, and they have potential risks that we have to watch out for. So, okay, and next slide, please. Other than the regional differences, we also look at the gender differences, and research has told us that men tend to suffer stroke, are more prone to have strokes. And other than the gender differences, there's also the age differences. Stroke can affect people of any age groups, but the older you are, the more a chance of getting strokes you may have. So this is something that we also have to watch out for. And also we have to look at which age group, whether it's male or female, or what kind of lifestyle may be a factor. Let's look at the next slide, please. Now, we all know that usually strokes have to do with our health conditions, especially if you have hypertension or diabetes or hyperlipidemia or overweight, or if you, I mean, those people, they have high risk of having strokes. Other than the health conditions, actually, it also has to do with our lifestyles, our lifestyle habits. For example, there are some habits that may elevate your chances of having strokes. For example, drinking alcohol, smoking, or lack of exercises, or even some stressful lifestyles may also be more susceptible to have strokes. So in these 2 days, you probably have learned that strokes and even pre-strokes, maybe there are signals inside our body that tell us something is happening. So in the next slide, we can say that there are some symptoms like difficulty breathing, shortness of breath, dizziness, irregular heartbeat, tinnitus, chest tightness, and chest pain. And we talked about the mental side too, the emotional side. So of course, it all depends on where the stroke is located. And it may also affect us psychologically or behaviorally. And for example, if you have anxiety, depression, insomnia, and you cannot control your temper, then yes, those behaviors, for example, poor appetite, or your declined memory, or insomnia, speech difficulty. So it depends on where the stroke happens in your brain. So we psychologists, other than looking at how it affects us mentally, another thing that we are interested in finding out is to ask the question backwards. That is, will our emotions affect us in terms of having strokes? We've talked about post-stroke. So we have all these aftermaths, right? But let's look from the other side of the coin. And if we have bad, poor emotions, are there any high risk? Does that mean high risk for us to have strokes? So this is something that we want to find about. So in 2019, there was a research that was done in North America in JAMA. It's a medical journal. They did a research, and they found out that actually it's a grouping of 15 different researchers of 230,000 people over 14 years, or as a long-term research. That means that this research, the results, the findings, I think are quite representative, right? So I mean, it's done over 14 years, over 200,000 people. So maybe it's a point of reference. So the overall findings, one of the things that they want to find out is, among those 200,000 people, what about their optimism, the degree of optimism? How does it affect their health? That's what they wanted to find out. So in this research, the findings show that it's interesting, because the more optimistic you are, an optimist, they have lower risk, maybe 14% of suffering cardiovascular and cerebrovascular diseases, even up down to 35% of suffering cardiovascular diseases. So that's a very huge percentage. So if you can also quit smoking, quit drinking, maybe you can even lower your risk of having strokes further down. So this is very interesting. And other than these lowering the risk, another important funny thing about this is the age group. It doesn't matter what age you are, whether you're 10 years old or 70 years old. The findings are, as far as the lowering the risk is concerned, it's about the same. So it's regardless of age group. So those researchers, they say that optimism is wealth. Optimism is wealth. So really, don't overlook it. So try to be optimistic, right? And so try to be stay positive. And we can also imagine those who have risks of having cerebrovascular or cardiovascular diseases. So What are the factors of having an optimistic personality? For example, are you being too negative, or is it kind of difficult to be optimistic given these negative environments? So, but there are things that we can change. One of the things that we can change is our way of thinking. Now, this is something we can change. Now, how do we change our way of thinking? Well, we can start with paying attention to how do we think? How do we solve problems? Do we have knee-jerk reaction and being negative? Do we also always act as opposition? Always say no to this and no to that? Are we too one-track minded? Like iCON, I mean, this forum. Today, I mean, this year we cannot have face-to-face, in-person forum. So why not have it virtually, online? So there are different ways. You don't have to be one-track minded to that. And how about only seeing shortcomings, being cynical? You only see the bad side of the coin, and so you say, "Oh, it's useless to do this and do that because the end result is the same." But actually, you're missing a lot. You don't see the advantages. So you should focus on your ways of thinking to solve problems, to think about problems, and pay attention to things like, oh, this is how I think. Oh, this is how I solve problems. So if you are aware, you are mindful of these things, so it's going to be a lot simpler because you then have choices. You can tell yourselves, oh, do I really have to think this way? No, really. There are many approaches, and you can learn to choose different ways of thinking to solve problems, to think about problems, and these are ways of thinking you can practice. But you have to remember, if you have to change your attitude in life, it takes time. It's impossible to do it overnight in 2 or 3 days. But I have good news for you. If we can do it every day, practice it every day, like Wendy was telling us, if we exercise every day, well, the good news is, well, maybe after 4 to 6 months, you will become, your new lifestyle, your new way of thinking will make you an optimist. So this all depends on you. You have to practice, and then very soon, within 4 to 6 months, you will have a new personality. You'll be an optimist. Other than the moods that we talk about for those who have strokes, how about caregivers? We have also pay attention and care for their well-being. So a lot of research has been done on this, and it's the most difficult periods during the first 6 months. So just now we're talking about 4 to 6 months to become an optimist or change of thinking. But we should also allow ourselves a little time, maybe between 4 and 6 months, to learn how to adapt to new lifestyles and as well help us reduce our stress. Other than that time frame, research has also found that the caregivers, maybe there are different stages that they experience. Maybe at first they experience pain. We can understand that, of course. I mean, all of a sudden, these changes. And gradually, they may come to a stage where they feel responsibility. Oh, because this is my wife, my husband, my father, my spouse, so this is an adaptation period. It's like going on to a new job. You have to get your feet wet, and then the later stage is an option. It becomes an option. So you can say to yourself, it's not because I really have to care about this person, care for this, because I've chosen to care for this person because I love this person. And then comes opportunities, and you will realize that when you take care of this person, there are opportunities for you to learn about how to change your own life, to shape your own future. And even if you make this work and accept this as one of your new lifestyles, then this will be a good mindset, a very positive mindset. So we can learn there are so many stages for a caregiver, and then you can transition from one stage to another. And last of all, if we know that the caregiver, the age of the caregiver, they have their depression index as well as the patient's dependence index. Maybe if you know those, you can also find out what each family needs in terms of taking care of the stroke patients. So before the patient is discharged to go home, we do an assessment and to see, to identify what those families need, what families need more and what families need less, and then we can reduce their stress. So I hope this information that I've shared with you is helpful to everyone to help us realize, to help us know how to take care of stroke patients and help ourselves reduce stress. Good information, Dr. Young, especially optimist. Like, the blood type of optimists, they all be positive. Be positive is blood type of optimist. So you talked about the caregivers, different stages, between 4 to 6 months of adaptation period. That's really, really helpful. Tigers, no, thank you. So our participants, if you have any questions, just click on the Q&A icon and put in your questions. I'm sorry, and there are personal questions that we may not be able to answer today. However, if you just input your questions into the box, we will try to answer them. Next, our topic is for Winnie Lau to come to talk to us, talk to us. She is a registered psychiatric nurse. Before we do that, we'll have another poll question. The question is, after you've heard from Tigerson about caregivers, about the mental side of it, is it helpful? Let us know. Our poll is now open. Give us your opinion. We hope that we will find out how you feel. And when you think about this, at the same time, when you have questions, give them to us. Wow. Our participants are getting quick in answering these questions. Well, thank you. Thank you for being so enthusiastic. And after you have input your questions, if you have other comments, you can also give us your comments and we'll look at them. So actually, there's a lot we can learn from you too. So we have closed the poll question. 70% of our participants strongly agree and 30% agree. There's 0.1% that are undecided. So our third speaker for today, she's also very experienced at Vancouver Coastal Health. She's worked there for many years. She is Winnie Lau. She is a registered psychiatric nurse. Now, Winnie, thank you very much for coming here today to talk to us about especially mental health resources for caregivers and stroke patients, especially counseling for them. Welcome.
So, hi everybody. I really thank you to have me today so that I can talk about resources in the community. Thank you, Winnie. I know that today you would like to talk about what you can do as a psychiatric nurse in the community and how your work can benefit patients or the family. You have a question for everyone, right? My question here is depression treatable? So you can think about it, and towards the end of my presentation, then you can give us the response, and then we are going to talk about it. So first of all, respond what you think. Is depression treatable? Yes, no, or I don't know. The poll is now open. Now, Winnie, Manny says, yeah, it can be treatable, but seems like 10% says not sure. And then 0.1% say no. And this is roughly the breakdown currently. So let us close the poll. And Winnie, how do you interpret these answers? So actually, these answers shows that depression is treatable. So if a patient receives treatment as soon as possible, most people can recover. However, would it come back again if there is a lot of stress, a lot of challenges in life? A patient can have depression again. And therefore, just like Dr. Young said, after recovery, how to learn to manage your psychological health, to lower the stress, to take community activities, and to learn skills to face stress, to learn relaxation. And all this would may be lowering the chances of having depression again. And Whitney, a question for you. So when a patient goes home, what arrangements can be have to be done in order to touch base with you? Maybe let us talk about the time when they are about to be discharged. Earlier on, Wendy and the doctors yesterday talked about it. The team in the hospital would assess the need of the patient, and they would connect with the family and have a family conference. So after discharge, the hospital social worker had already connected with the community services. So the first basic one will be the home care services. So in case of a stroke patient cannot move very well, and then usually they would arrange for bath assistance or to reheat meals, or they would send people to administer medication. So here in the hospital, services can be arranged beforehand because many family members may only be able to give medication to the patient in the morning or in the evening. And then during the daytime, there is nobody to help with the lunch or medication. And therefore, home care services can have home care helpers to come in so that they would be able to. And they also have pharmacies in the community. They may arrange services like these. The second type of services would be related to safety at home, just like Wendy had mentioned. So before the patient is discharged, the home environment would be assessed. However, even when the patient is at home and they find out that something is lacking, for example, the toilet bowl is not high enough or the bath bench is not suitable, then the organization that was given treatment could arrange for a community OT to pay a home visit. And furthermore, a PT, a physiotherapist, can also be referred, then go to the home to prescribe suitable exercises. And usually these would be arranged by the health organization. And usually in the first 2 weeks post-discharge, usually there is a case manager. The case manager would give the patient and the family a call to check on the patient. The family may say, oh, I still do not have enough services. We require more. Then the case manager would pay a visit to the home and may increase the services. However, if the family does not hear back from the case manager, then shall we have the next slide? Yeah, there is a slide. Okay, and you can see the first number. This is the home health services, which is run by the health unit. And well, if you don't hear from the case manager, you can call this number, leave a message, and then upon receiving the message, they may give you a call or to refer to the health unit, and then get in touch with the case manager to call the family. So this is the health unit, what they would do with the connection when the patient is discharged. Oh, I got it. That's really good, Winnie. So it seems that a lot of preparation has been done before the patient is discharged. And then upon discharge, there will be a case manager to help, and the family would be connected by phone. And so to get all the services in place, that's really good. But what about counseling or help with mental health? So what can be done? So after the physical need, we talk about the mental need. So usually for the health units, usually say hospitals and so on, they take charge of the physical need, like a bath or medication. But for our mental health team, we focus on totally different things. We focus on the emotions, or the memory, or the behavior of the patients. This is usually the areas that we focus on. And from my experience, after having a stroke, patients would have depression very easily. And also to have the beginning display of dementia. Early on, Dr. Young had talked about the psychological needs and how to meet the needs. And if family members found out, well, after the patient is discharged, I know there is a period for me to adapt. But after a period of time, it seems that the patient's mood is very undesirable. Is having a lot of mood swings. They can suddenly be acting out or suddenly be crying for no reasons. And also they may even say, oh, living is not worthwhile. I'm a burden to the family, and I do not see any hope in front of me. The only thing on their mind is to end their life as soon as possible. Or sometimes they may have very poor appetite, and they keep telling, oh, I feel unwell all over. I have abdominal pain. I have tired eyes. I have to close my eyes because I don't have any energy. And some even may say they may have hallucination. And they may be saying, oh, I hear something. Usually that would be unpleasant voices, maybe telling the patient to die or to hurt himself or herself. So you may find out the memory may also would have a short-term deterioration. For example, they may hide things away in a very, very secured but secret place, and they do not remember. And they would tell people in the family, well, where have you put away my things? You shouldn't be hiding away my stuff. And then if the family tried to reason with the patient, and the patient would lose temper, and then they would say, oh, you don't trust me. You are not really have confidence in me. And also the patient may be complaining that there will be other people stalking them or checking on them or monitoring their day-to-day living. So this is very important. The family members should bring this to the family doctor, because the family doctor can do assessment to see whether the patient is necessary for referral to a psychiatrist. Or sometimes, well, they may rule out some physical conditions, because sometimes physical conditions can, affect the mood. For example, if you have a bladder infection, of course, it would affect your mood. And then if you take antibiotics, and things can turn around very quickly. However, if the physical health is okay, then the family doctor may be able to refer to our mental health team. And also, even the family can give us a call. So you can see the second number, and the second number is the referral line. You can leave a message, and our colleagues will return your call to follow up with the family to check on the situation. And we would also check with your family doctor to get more information. And upon that, we would plan a time to pay a visit to the family, and the nurse together with the psychiatrist would assess the need of the patient. However, sometimes when it is felt that the situation is really bad, the patient's mood is very, very bad, and the behavior is really unstable, then at the initial visit, then we have the central intake department, and usually we would try prescribing a little bit of medication to try to stabilize the situation. And with medication, of course, it requires the follow-up of a doctor. And after that, we usually would split the services geographically, and we would refer to the mental health team belonging to your geographic area. And the doctors in that particular team would also go to pay a visit to the patient, and hopefully can monitor and regulate the behavior and mood of the patient. And we also know, being family members, taking care of a stroke patient is already stressful. And on top of that, having to face their psychological and mental health situation, it will be even more. So we do hope our services can reduce the stress of the family. Oh, thank you, Wendy. A lot of good information. I've got a question for you. So before my question, any further information? Oh, I know. Okay, so unlike Wendy, I miss out some. So sometimes at the emergency department, I thought that things like this were normal. So I decided to wait. And after waiting, I decided to go to the hospital. So sometimes after a stroke, for our mental health and the moods, it could be having a lower mood. So what tips or what signs would there be so that we can be alert that mental health services are required? So what do you think of is the tipping point? I think my suggestion is earlier is better. So once when you notice anything, the mood is not stable, or a person is irritable, getting angry very easily, and then also complaining, oh, it's not worthwhile living, or hearing noises. So don't wait, because if you wait longer, the situation can get worse, and it will be much more difficult to treat. And you may have to go to the hospital, and then you have to take a long time to recover. So just, well, go ahead. Give us a call, and then immediately we can assess whether it is important for us to pay you a visit immediately. Oh, so this is important. So don't wait, don't delay. Try to voice out your concern as soon as possible. So thank you, Winnie. This is really good. And so everybody now, if you have further questions, please punch it into the box of Q&A. And then later on, Winnie will take part in the Q&A later on. Okay, now the same thing. Let us look at the next section is almost the next section. So we are going to have Jojo. So today she is going to go on about the diet. But before that, we have a poll question. So
Yes,
what did Winnie said, is it helpful? Do you find that it is helpful? And then the resources in the community, is it helpful? So I opened the poll for you to put in your answer. So actually, there are situations, thus such changes do not come very suddenly. So these changes come gradually, and then sometimes it's more subtle, and therefore it takes a lot of observation and to request for help as soon as possible. That is very important. Oh, this is very good. Thank you for your responses. And a lot of people would say strongly agree, and then there is 1.2% say that they are undecided. So if you have a question, put it into the Q&A box. So a few people raised their hand, but I'm sorry, I cannot invite your question. So please put it into the Q&A.
Okay, we have closed the poll questions. Now we come to our fourth speaker. We're going to invite our registered dietitian, Jojo Wang, again. Thank you for coming yesterday and coming today. No, I thank you for your invitation every time. I'm honored to share dietary information with you. Jojo, I'm very happy. Yesterday we talked about the Mediterranean diet, the pyramid. Now, how about creating a seafood for Chinese patients or Chinese eaters? Now, after a stroke, okay, how about, diet is a major issue. So I want to ask you today, someone who has a stroke, who has had a stroke, during the recovery, how do you manage his diet to help? Well, just now, Winnie and Tygerson have told us that after a stroke, it affects different parts of our body, our mind, and now we'll talk about nutrition. We'll talk about swallowing, and this is actually a common problem. Not that every stroke patients will have swallowing difficulties, but if you do have that after a stroke, and maybe there's a risk of having malnutrition after that. So nutrition is a factor that will affect your recovery process. So we want to help as much as possible. That before I do that, let me take a poll question. Now, do you know anyone who has had a stroke before? Have you had a stroke before? So which of the following is a sign or symptom of having difficulty swallowing? So this is an open poll now. There are 4 choices. 1 is persistently drooling of saliva. B is coughing when eating or drinking. C is having the sensation of food stuck in your throat. And D is all of the above. I think our participants are very well aware that we see about 90% says all of the above, that all of the above could be symptoms of swallowing difficulties. So if you realize that someone you're taking care of has this problem, swallowing problems, And we should know why this can affect us so much, because it not only affects our nutrition, it will also affect the chances of having pneumonia, because every time when you swallow something, whether it's liquids or solids, because a normal person, when they swallow saliva, they don't think about it, it's involuntary. But after you have a stroke, maybe every time you swallow some saliva, there's some difficulty. So the saliva may drool out, and you probably won't feel it, and you cannot control it. So when they eat, that saliva goes down into the lungs, and their immune system is weaker than ours. So over time, when food and these remnants are left in the lungs, the chances of having pneumonia are higher. So when you have to eat, when you have to swallow, it's very important to do it safely. So how do we know that you have these? How do you know that you may have swallowing difficulties? We have silent aspiration. So some people may have difficulty swallowing, but may not have these symptoms. So how do you know what they have that problem? So don't worry about it. So if you do have a stroke, if you have been in the hospital, our medical team will help you do an assessment, a swallowing assessment, and to make sure that you, when you swallow, it's safe, and this is done by a speech language pathologist or an occupational therapist who will do that, and they will give you foods of different density, different texture to test you, and then you can choose the safest one, the safest texture, the safest thickness. So if you have this kind of problems, and if you have to change your texture, the food texture, many times the patient will have poorer appetite, because it's different, the foods are different from those that he or she has been used to. So maybe the appetite is not as bad, or maybe the mood is not as good. Maybe there are things that he or she could do before and cannot do now. And so how we can help them? We can try to make the foods more attractive. Like if you want to change the texture, you can mince them, you can chop them finely. First of all, you put it in, like in a ball shape, of course it's not as attractive, but if you put your mind, put your heart into it, so we can look at two pictures here. On the left side, there is sushi, and on the right side, there's a sushi shape ball of rice, and it becomes more attractive. So you want to try that too. Of course, you have to take a little more time, and but if you do need to do that, then you can make the food more appealing and more palatable to the patient too. So in terms of liquid, for example, soups and other liquids, we probably cannot and control the thickness. But if you have difficulty swallowing, the faster the liquid flows, the faster it will go down into your lungs. So we need to make it thicker. How to make it thicker? Because, well, if you make it thicker, it's easier to control. At the same time, when you drink water, you would have to drink more slowly. And also, if you drink a lot of thick liquids or fluids, and it makes you feel more fuller. So that is part of the nutrients that you take in as well. So if you need thick liquids, fluids, our suggestion is to put some nutrients into the liquids, and not just drink pure water, but drink fluids with some nutrients in it. So we've talked about textures and density of thickness of foods, how to change them. As far as nutrients are concerned, you may ask, after a stroke, how do we use nutrients to help our recovery? Yesterday, you remember the pyramid. Let's look at it again. Actually, we follow the principles of this Mediterranean diet pyramid, because after a stroke, we want to prevent, or we want to lower the risk of having a relapse, having another stroke. So these are the basic ingredients of a Mediterranean diet pyramid. So we have to remember, those who have had a stroke, their appetite may not be as good, or maybe they may not be able to eat right away after a stroke. So of course, because of they have a poor diet, so their weight may be reduced. So we have to make the nutrients make it intensify these. So, for example, high fiber foods, vegetables, fish, fruits, or beans or legumes, and how do you make them more dense? So you choose high-calorie foods and try to give it to them when they have a better appetite, and hopefully they can intake as much nutrients. For Chinese menus or recipes, it's not so easy to do that, because when we cook rice, when we make a meal, we don't put in a lot of high-calorie or high contents of oil in it. So my suggestion is to put some oil in your foods, or every meal, remember to put in some protein-rich foods or high-calorie items such as avocado or nut jams. Or if you eat dairy products, eat cheese or yogurt. And it's a little different from the usual recommendations that I give, but hopefully in terms of having less portions, and there's still as much nutrients. And yesterday, a lot of questions were asked about what kind of oil to use when cooking. In this pyramid, we didn't cover that. So today, I can also mention the oils. Actually, in this pyramid, we have all talked about flour. We talked about every day. We talked about eating whole wheat grains foods. But when you eat brown rice and other types of rice, which are different, there are different colors, and it doesn't matter what color, as long as it's a kind of brown rice, and maybe it's not very suitable for mincing or for puree recipes, but you still have to try to grind it as fine as possible. And if you don't have any swallowing problems, you can eat any kind of brown rice. And oatmeal is another good choice. Now, in this pyramid, we have also suggested that you take olive oil. So some people are concerned whether you can use olive oil for cooking, but actually we have used talk about smoked corn oil, and for example, extra virgin olive oil, and they are more suitable for making salads. And actually, if you buy just an ordinary kind of oil, not without extra virgin, just an ordinary olive oil, the color may be lighter and it's not dark. It's a transparent oil bottle, and that kind of olive oil it's good enough for you, as long as it's not too red. And if you just put the oil in there and you do not put it in high heat and not add anything else, then it's not good. But olive oil itself is good for cooking. How about peanut oil? And actually the saturation point is pretty high. I don't know if you've paid attention to the older generation, when they deep fry things, they use peanut oil because their heat resistance is higher. But of course, now we recommend that you do not eat so much deep fried foods. However, peanut oil is still a healthy choice. It's just that the fatty acid is different. So, of course, flaxseed oil is good because it's got omega-3, but you cannot use it for cooking. But after you have cooked, you can put in some flaxseed oil plus omega-3 oil, and that will not affect the structure of the oils. Finally, there are some important points. You have to remember that if you have a stroke, you have a problem swallowing, and you're concerned that you don't have a good appetite. So keep hydrated. It's important because if you're not adequately hydrated, then it may affect your energy. So keep hydrated. It's very important. So you should also make your liquids thicker by choosing liquids with nutrients and not just thicken your soup, or you can also drink milk or milk with nutrients. And actually, it's full of water contents, and there's a lot of nutrients in it, and it's a good substitute for water. If you have a poor appetite, eating less portions and more frequently is also important, because sometimes it takes a lot of effort to swallow, to swallow one gulp. So you should eat more frequently, but less portions to have enough nutrients. Also control your weight, not try to reduce your weight, and not try to have it reduced too drastically. Because if you do not have enough nutrition, then maybe you will lose weight. But we don't want you to lose weight too drastically. We want you to keep a balanced weight, and also keep your mouth clean. That's important too, especially if you have swallowing difficulties, because usually we brush our teeth 2 times a day. But if you have swallowing difficulties, maybe after every time you eat something, you may have to brush your teeth, because you may not be able to swallow everything in each gulp. So you may have some remnants left in your mouth, and there are germs in there. So if you have problems swallowing and you've left enough germs there, and then even if you swallow some saliva, those remnants may go down to your lungs. So the risks are higher. So the best thing to do is brush your teeth or clean your mouth after every meal, and of course the usual twice a day brushing your teeth. So that will reduce your risk of having pneumonia. Wow, Jojo's a lot of information. Again, many things. Strokes, swallowing is an issue, and also intake of nutrients is also another major issue. Also the density, the thickness, the texture, cleaning your mouth, all those are important. Very important points you've brought up. Thank you. Time for questions, almost. Now please keep giving us your questions. Before we do that, there are a few polling questions. I want to know, how about your understanding of what, after you have heard Jojo, based on what you've learned, are you able to better understand how stroke patients should manage their diet post-stroke? So Jojo was suggesting making it more attractive, more appetizing, making it look like, presentation is very important for food. To make it more appealing is important. Okay. 3/4 of the people agree that they already got a lot of new information, and another 20% agree. So we close this poll. 3 more simple poll questions. The next poll question is, now this session provided information to help patients and families make good decisions about their health. So does this session provide information to help patients and families make good decisions about their health. We thank you for answering these questions. We hope that with these questions, and if you still want to know more, you can create your own questions, and Barbara will host that segment. Now we can close the poll for this one. Thank you. Next one. As a result of my participation in this forum, I feel more confident in managing my health. I hope that you will let us know whether this has been helpful to you or not. Okay. Good. Good. Thank you. Thank you all. We will close the poll on that one. All right. 60% strongly agree. 4.5% agree. So another question. I learned about community resources and services that are available. And are they helpful to you? Okay. I know that 0.2% of the people say that it's not very applicable. So there are people from around the world who have joined us. Thank you very much for joining us in all corners of the world. I hope that they have been helpful to you. All right, that's all for the poll questions for the time being. And we're going to close the poll. I'll pass the mic back to Barbara. This next segment is fantastic. We are going to answer lots of questions. Many participants want to know the answer. Thank you, Dr. Ho.
Thank you, Dr. Ho. A lot of good presentation, a lot of presentation, especially for Winnie, who comes the first time, sharing a lot of resources in the community. So on seeing the questions coming in, I can see that many people care for the mental health resources in the community. So how can they come in contact with these services? So I'm going to talk to Winnie later on. And today I really would like to thank Dr. Ho, who already talked to us yesterday. So Dr. Thomas Ho is not here yet. So Dr. Thomas Ho is a family doctor. And then Dr. Richard Ho is a rehab doctor. And we thank you for Mr. Ling, who joins us together, and he is answering questions regarding medication. Thank you, Kent. And there are a lot of questions. I really appreciate your efforts putting in all your questions, and some of those already have been answered yesterday. Yesterday, there were over 100, and today, well, the number is really high, and I really would try to sort them out and talk about them. So first of all, I would like to talk to Dr. Ho. A few people would say if they feel that themselves or the people around them have symptoms of stroke, should they immediately take aspirin? Usually, if aspirin yes, it does help to thin our blood a little bit. And then if there would be blood clots, it should be good. I'd like to ask Dr. Kendo Ho. So when you work in the ER, if a patient already consumed some aspirin, so would it affect their condition if their stroke is a hemorrhagic stroke? So actually, 2/3 of patients belong to the ischemic stroke, and maybe 1/3 will be hemorrhagic stroke. So when they go into the ER, the first thing we would do the scan, because of scanning of the brain, because the scanning will definitely let us know whether this is a hemorrhagic or not hemorrhagic stroke. So aspirin would be very helpful. However, if surgery is required, and at the same time, we would provide different choices of blood thinner to the patient. So if the patient is going to the ER, try not to give them aspirin. Then we would try to do assessment immediately and take suitable measures. But Dr. Thomas Ho was right. If it's not ischemic, if it's not hemorrhagic stroke, then taking aspirin is very good. But the most important thing is go to the hospital. We can decide and then take suitable measures. So there are different questions about stroke symptoms. So should one drive to the hospital or call or dial 911? Because, well, usually people are very nervous, especially if this happens to the person next to me. For example, it's my wife or my hubby. So if something is wrong, so should I be driving the patients there? So this is my suggestion. So it is serious, and I don't drive. So for family members who drive, it may not be the best choice, because if you call for an ambulance through 911, so yesterday you heard Dr. Ip say that even before the ambulance came, actually they already made calls to the ER to report the situation. And so especially for serious strokes, once the patient has gone onto the ambulance, so the attendants would already start assessment, and therefore they have already started the treatment process. And so I recommend calling 911. And if you think it is not serious and then you're not too sure, then it's okay for the family to drive. But if you drive, that is not recommended, because you may get more serious on the way, and that will be even worse. So again, serious situation, call 911. Minor situation, well, drive your family. Another question. And if a friend or family feeling unwell, so should the person be sitting down or lying down to wait for the ambulance? Well, feeling unwell, I think, is about symptoms of stroke, right? So it depends on the severity. Standing, of course, is not good. Sitting up, maybe, or lying down. So if it's serious, don't lie on the back. Lie on the side, because when you lie on the back, if a person may be vomiting, then there may be aspiration. And if you lie on the side, then even if there is vomiting, it would come out of your mouth instead of aspiring into the lung. And if the head is slightly, maybe 20 to 30% raised, then usually it is better. And if a patient is seated, and if the stroke only affects the face, then it is okay. And today, wow, we have more and more questions coming in. About moods. There are a few friends. So pardon me. Oh, yes, a few questions come in regarding the patient being very stubborn. of course, even after a stroke, the patient can be happy and is very, very negative and would say, oh, this is bound to happen. I'm old. I'm not going to recover. I'm not going to do any rehab. Well, leave me alone. I'm not going to any program. I won't go to the doctor. I can't be helped. So Dr. Young, what suggestions do you have for the family members to help to encourage the patient to receive treatment? So I think one of the things that I would suggest is to the patient has a lack of understanding of stroke. So the person may not understand that with cooperation of treatment, then even though one person may not recover 100%, there is always room for improvement. And therefore, one thing is to try to improve their understanding. So maybe learn to them to know more about what stroke is and what are the effects of stroke treatment and rehabilitation. And once when their knowledge has increased, they may not be rejecting as before. And just as Winnie has said, and there is actually different resources in the community. And if they come into contact and see other patients, and seeing other patients would have benefit and improvement, then their confidence can be increased. So I think from various aspects, they can be helped. So one person asked in the same area, so being so negative, what kind of games or means can help such stroke patients so that they can feel more relaxed and feel better, so that they're not as depressed? Okay, so well, maybe watching comics. Yeah, so yeah, watching comedy. But going back a bit, you have to figure out why the person is rejecting things. So as I said, watching comedy is actually not a joke. Sometimes these movies like this can distract us. And this helps. For example, there are research like music to help us to relax our moods. Of course, it may not directly address the treatment of stroke, but it can help our moods and therefore building up us a hope. And that may be helpful. And the most difficult things that I have seen is people are losing hope. And if the hope can be restored in the patient and the family, so usually that is beneficial. Okay, thank you. The next question I would like to ask Winnie. There are a few questions regarding the hotline or the referral line. So is that line for a particular area? It is for Greater Vancouver? And for the elder adult mental health, is this only for stroke patients? Or could it be patients having other conditions? So can they ask for help? And also, if the caretakers have the need for mental health services, would they also receive services? Oh, Winnie, please turn on your mic. Okay. So the hotline is for Vancouver area. So it is for elderly. So, and actually the health unit is not only for stroke patients. We don't accept only stroke patients. So just as I mentioned earlier, if people are having fluctuating moods or deteriorating memory, so even though it's not about because of stroke, they can ask for the referral of the family doctor, or they can give us a call to explain what situation, and then we can return the call to find out more. Oh, let's talk about the rehabilitation. Hi, Richard. There are a few questions for you. One of it is, if the patient is relatively young, maybe 20 to 30, so would they recover more quickly? Oh, yes. This question actually relates to the situation to see how which area of the brain is affected. So if you look at two different persons having the same injury but of different ages, so usually the younger person would recover sooner and then recover to a greater extent. So there are two reasons. One is the younger person's the brain cells, the power of and ability of regeneration is much faster than those of the elder person. And second, when go into rehabilitation, usually younger person can learn skills and then they can improve faster. So that is why. Another question for you. So doing exercise, would the person receive another stroke because of the exercise? So during doing exercises, seldom a person would receive a stroke. So sometimes if the exercise is really very strenuous, so maybe the rupture of blood vessel can happen, but this is really rare. And all in all, exercises are good. And this is good for stroke patients. There are several reasons and several things we have to pay attention to. It has to be moderate. So what does it mean to be moderate? You have to look at your heart rate. So the exercise should increase your heart rate. And also during your the time when you're doing exercise, you can chat with the person next to you, but you cannot sing. During 1 week, you should do a total amount of 150 minutes of exercise, or you can say break it down to 30 minutes a day. And it can be walking, it can be biking, swimming. So if you cannot manage, you can be walking in the pool. Okay, thank you. And there are two questions I would like to ask Kent. So this friend of ours, I would like to ask you, this person cannot take aspirin because of allergy. And hearing that when some doctors say when you have the symptoms of stroke, so can you take aspirin? Does it have a counter effect with antihistamines? Would it affect the effect of the aspirin? Antihistamines and aspirin on their own, they do not have interaction. However, the most important thing is, so when you are allergic to aspirin, is it real aspirin? Or do you feel unwell or just have some hives? Or is it difficulties of breathing? So it depends on the severity. So when you say you have you're allergic to aspirin, it may not be just the side effect, but not really a serious allergy to aspirin. But I would say aspirin and antihistamine, they do not interact with each other. Oh, so that person can put some aspirin in the pocket, and he also has to find out whether he has allergy to aspirin. Okay, Let's go back to Dr. Thomas Ho. Yesterday, you mentioned the high risks of stroke. Now, one of it is atrial fibrillation. So how can we check whether we have atrial fibrillation and what can help the symptoms of atrial fibrillation? What can be done? The first thing, AF, is actually irregular heartbeats, but not all irregular heartbeats are atrial fibrillation. So if you try to take your pulse, it's very regular, pump, pump, like that. It's regular. But sometimes it may go pop up, pop up, pop up, pop, and then that may be irregular, but not that bad. And for atrial fibrillation, it can be really no pattern at all. So roughly, first of all, you learn about it. However, to confirm that, you have to do a EKG so that, or you have to do echocardiogram so that so as to find out. For some atrial fibrillation, it does not happen all the time. So this kind of AF is difficult. AF, so because it doesn't happen all the time. So just like what I said, these infrequent AFib also can increase your risk of stroke. So we can have the 20-hour Holter monitor so that hopefully during the 24 hours, such AFib episodes can be picked up. And the second question, what is it? So what can be done to release the AFib? So actually, if a person has the condition of AFib, the worst condition will be having blood clot, and the blood clot may be passed on to the brain and causing cerebral stroke. So if you have rapid ventricular rates, so sometimes the heart rate can be very fast. And some people even have a normal heartbeat or even a low heartbeat. So we don't just look at the symptoms. The most important thing is to do prevention, preventing the bad things like a stroke to happen. And therefore, we have to use suitable medication like blood thinners, warfarin. So we have DOAC, or there may be ablation with surgical measures, because some people cannot have medication because of the stomach, and there would be other measures so that we can prevent from the blood clots from going into the brains. Oh, let's see. Do we still have time for more questions? Okay, 2 minutes. Okay. So very quickly, let's take one more question, and then Jojo, thank you. You picked up some questions and answered them. Answer questions posted yesterday. You have already explained what kind of oil we should be using. And here, I think this person would like to know the consumption of protein. What portion? Would there be a difference in the portioning if the seafood or meat? Actually, high protein food should be a quarter of the meal. So if you really look at precise portions, so maybe 3 ounces, or you can use your hand. Everybody's hand is a little bit different, so use your own hand. So look at the palm, not counting the fingers. Look at the size and the thickness So this is roughly the amount of the high protein food that you should be consuming. Whether it is from seafood or meat is okay. But if you are a vegetarian, then you have to take in a bigger portion, because usually the food is not high in protein. And usually we don't look at the consumption only for one meal, because we have 3 meals or frequent meal. As long as you have protein in every meal, that is important. The last question about beverages. So when you say thickening of beverages, are there any exercises to help with the swallowing? I cannot answer it, because this requires a speech and language pathologist who are specialized in assessing the ability of swallowing, because everyone's exercise to improve swallowing are different. There are exercises to improve our muscles, and some people can so improve that they would not require any further thickener, and there are chances they can go back to normal diets. However, people like these require assessment of the SLP and to prescribe exercises. Thank you, everyone. And I'm afraid because of time limits, we can only answer this much. We still have questions coming in. We will try to find ways and then to answer your questions and put them on our iCON website. And actually, we are going to examine the possibility just for a seminar to answer all different questions. And we would like to invite the same team of specialists so that we can answer these questions. So how we are going to respond and answer the questions, we will follow up on our website. And if we can really have a workshop to invite everybody to answer the questions, then I think that will be perfect. And we would announce that on our website. So thank you, every one of you. You come to make this seminar possible. And Dr. Kendall, would you like to say some words of acknowledgement? Oh, yes.
Yes, I really appreciate so many of our speakers, your fantastic themes and your suggestions are very helpful. Many thanks. Also, we want to thank many partners who are community organizations such as Success, Vancouver Second Mile Society, Vancouver Catholic St. Xavier Parish Church, and Yarrow Intergenerational Society, and Vancouver Public Library, Chinese Canadian Medical Society, and Catholic Villa, and all these community organizations, we are very thankful. Thank you very much. We also thank our media partners, Fairchild TV, Fairchild Media Group, Television, Fairchild Radio, AM and FM radios, Canada Omni TV, and Tsingtao newspapers, Mingpao Daily News. We thank you very much for your help. We also want to thank our partners, exhibitors, Summer Society of British Columbia, Canadian Mental Health Association, Family Caregivers of BC, Heart and Stroke Foundation, Pain BC, and Self Management BC. From you, Vic, which is a department at the University of Victoria. We also want to thank our on-air platform. Thank you for your support and organization, and for those people who help us organize these activities, especially our interpreters, and for Mandarin and Cantonese and English interpreters. They are very professional to interpret for us so that the public can all get this information. We also want to thank the Ministry of Health of British Columbia, as well as our electronics medicine planning, and of course Barbara single-handedly hosted these fora, and Sophia Khan as well, for their excellent leadership. Thank you for your support. And last but not least, thank you for all you participants who have come to attend our fora. And we thank you for your very interesting and helpful questions and coming here to join us on Zoom, on our platform. All these video footage will be shared online in a few days. So if you go to our website, you can see on the screen, this is our website, iCON website. And we will continue to do workshops, different kinds of workshops. And during this pandemic, we will also inform everyone when we're going to organize workshops, so you can register for those. And finally, I want to thank everyone for all this. And now back to Barbara. Thank you, Kendall. If you feel this platform, this is the first time that we're using it. If you have any comments about this platform and arrangements, you can email our iCON support page, and so that we can make improvements and use them as reference. Thank you again for your participation for yesterday and yesterday's fora. I don't think we have enough time for the 3 polling questions. Okay, I don't think so. I think I'll just skip the questions. All right, so that's it for today. Until next time, see you.